तबीयत किडनी का प्रॉब्लम था, तो मैं इच्छुक थी देने के लिए, लेकिन फिर पता चला कि अलग ब्लड ग्रुप है तो दिक्कत हो सकती है। फिर नायक सर ने भरोसा दिलाया कि नहीं, हम लोग अच्छे से कर लेंगे ट्रांसप्लांट। फिर टेस्ट वगैरह हुआ और ट्रांसप्लांट सक्सेस रहा, है ना। नायक सर, नवीन मेटेवाला सर, नवीन मेटे सर, सब ने बहुत सपोर्ट किया। मैं एक हफ्ते तक रही हॉस्पिटल में। हॉस्पिटल भी बहुत अच्छा, कहीं कोई दिक्कत नहीं, सब ठीक ठाक रहा।
Thank you, Mrs. Tinku Singh, for sharing your experience. Now, I'd like to call upon Raman Singh's wife, Mrs. Shivani Singh, for her experience. Okay.
Namaste everyone. As you know, I am wife, so I have little bit. Yeah, emotional throughout the journey. Sir, I got married in 2020. On 30th of November, I got married, and by 1st or 2nd of January 2021, we got to know that his blood pressure was very high, and we got to know this term, that is CKD, chronic kidney disease. The biopsies were done, and we were in a hospital in West Bengal. There is a place called Durgapur. So we were there, and the biopsy was done, and that TMA came, that thrombotic microangiopathy, right? And they said there is no stop here. His kidneys are 85% damaged, and he was in the 5th stage of CKD, right? And we were said dialysis is the last option you can go through, and we were sent home. But by 10th of January, we came to know about Sir, and he's like one of the best nephro that anyone could come up to. So we were here. Sir took him in for 15 days. He was here. Every possible test were conducted, and Sir, that very day, Sir said, with medicine, I promise you, I can stretch his kidneys life for 3 years, and exactly that happened. For 3 years, he was on medicines which was prescribed by Sir. Every month we used to get the tests, and Sir used to reply at any order, whatever happens, whatever things we used to experience, we used to message Sir, and Sir, no matter it is 12 at night, 1 at night, he used to reply, he used to control doses throughout. And for 3 years we were in constant touch. We used to come here yearly, and when he was here in August, his creatinine was at 8. Sir asked me, now we have to go through the transplant and just talk to in your family. Sir suggested for the siblings, and his sister was very eager to give. We were here by September, and Sir left no stone unturned to make this possible. Every test were done very thoroughly, and by 2nd of November his transplant was done. Again the TMA came, but they were very supportive. All the doctors were very supportive. They made me understand what was happening, what is going to happen, how they are controlling everything, and they not only supported us in a medical way but also emotionally, right? So not once, twice or thrice, will be in touch throughout my life. Like we may be like any other patient to him, but he is like only our last stop. Like we went to several places, but all of them were recommending dialysis. Like it's a very complicated case. Dialysis is only possible, but this was our last hope, last place, and Sir made everything possible for us. And whatever we say, whatever we do, it will never be enough to thank Mr. Nayak and his team. So thank you so much.
Thank you, Srimati Shivani Singh. Now there will be a question and answer round. If there are any questions from the press. Before the question and answer round. I'd like to invite Dr. K.S. Nayak, sir, who is a head of the Department of Nephrology and Renal Transplantation of Virinchi Hospitals.
Many of you here, I know you people personally, and thank you for coming over. I think by now you have got some idea of probably this is one of your rare exposure to the family that suffers from one of their loved ones developing end-stage kidney disease. So I'm happy that you realize how difficult this disease is, end-stage kidney disease, and getting out of it is something is like a new life, punarjanmam. But when it is a family that goes through a complicated issue and they knock a lot of several doors, and those doors are closed, that is the experience what Raman Singh and his family went through. They came to Virinchi Hospital. So I am very thankful for the support of Virinchi Hospital. Our team has been excellent, and our team does not, start or with me. It is a total team effort, and right from my colleagues, Dr. Naveen Matavara and Dr. Naveen Medi, the nursing staff, the surgeons, Jairam Reddy, Dr. Harish, and Dr. Hidayatullah, who could not come today. I would personally think the closest to the patient especially are the nurses. And I can without doubt say that we have probably one of the best systems in place, best nursing staff in place. I was just discussing with one of the senior most transplant surgeons in the country. Has he seen a post-op follow-up of a patient like what happens in Virinchi Hospital? He said, no, he has not seen. We are on the ground dealing with, and our fellows, especially I would like to mention Lekha and Rama, who were there, and that's what Raman Singh meant. So patients coming, we get patients for transplant, those which are refused by others and they don't have the ability or the intention, they want to do straightforward transplants. We do straightforward and complicated transplants. We have the confidence, and we were able to do that in spite of the risk involved. So I thank my team for that particular issue. What the secret of the success of this case was timely intervention. Apart from the preparation which Dr. Naveen and Dr. Naveen have spoken, we have Dr. Naveen Square. They spoke about the preparation that went into making ourselves confident that we might be able to come with a favorable outcome. It is very unusual, and it's first worldwide, except for this case in UK, which is a 12-year-old girl who had recurrence after had a ABO incompatible transplant and had TMA coming in, but the child is not yet out of the woods. But I can fairly, with confidence, say that Raman Singh is approaching the Lakshman Rekha of 90 days. I told him that just last week, that once you cross 90 days, he's not on any maintenance treatment, he's on regular kidney transplant medication. And his serum creatinine is normal. You can see he's an IT consultant, and he was instrumental in getting his sister online, and he helped our IT team. He's probably smarter than most of us in IT, and so, to put it in simple terms, thrombotic microangiopathy comes like a tsunami. It came like a tsunami for him, destroyed his kidneys. We were able to pull along for 3 years with medications, what we called supplemented low-protein diet, for which we have Aparna here who helps us in It's a medicine plus diet, which we have, incidentally, the largest series in the country. We have initiated about 3,000 patients. We have done 2,500 transplants, but we have more patients. And the happiest our team is when we are able to delay or postpone or even avoid a transplant. So he was, but I predicted to him that this is not going to be a lifelong treatment. He came in with a creatinine of around 7, we brought it down to 3, and then slowly it started climbing over the next 3 years, and he came for this transplant. Now this TMA, thrombotic microangiopathy, comes like a tsunami, destroys the kidneys. Most of the time it affects the kidneys, but also can affect the brain, and it can be a multisystem disorder, and it can kill the patient. He had biopsy proving TMA, and just to tell you briefly, if you are going through a very, what TMA is, suppose in the rainy season with the potholes, you are going through a bypass road and you have got, it's raining and there's a gutter on these both sides and water is filled in the potholes, and you are driving your car, which is not what you call state of the art, and you're driving at some speed. What will happen to the car and yourself? You can easily fall into the gutter or hurt yourself seriously. You may fall out of the car, you might get into an accident. Similarly, what happens is the capillaries, which take the blood to the brain and kidney, they develop potholes in TMA, in thrombotic microangiopathy. So the car or the bike, especially I would say, instead of car, it's a bike, you're on a bike ride, and the bike is going along the road. They are the RBCs, platelets, and all the formed elements we call. They all get destroyed and they fall off and they are no more. So the thrombocytopenia, which is platelet count, comes down, and they all destroy and form thrombi, which is actually that the driver and the vehicle have fallen down and they are dead. They go and block the kidney and the brain, and the kidney is permanently damaged. Now, such patients have a very high risk of developing TMA after the transplant also, and their kidney that is put in can get damaged. Now that, I think 90% recurrence was what Dr. Naveen told. But here was a difficult situation. There was no donor who was available to donate a kidney to Raman Singh. I think most of you know that unrelated transplant is illegal and a criminal offense. So we are a very ethical institute, and we do only cadaveric transplants, which is brain dead, which as Mr. Satyavedula, our vice chairman, spoke about it, that we were the first in the country in 1995. We did the first cadaver transplant. You are hearing about Jivandan. There was no Jivandan at that time. In 1995, our team did the first cadaver kidney transplant, second cadaver kidney transplant, third cadaver kidney transplant, all were done by us. And we were third in the country. Incidentally, we did the first simultaneous heart and kidney transplant in the same patient. We did that first in the country. So we are pioneers. We have done a number of liver and kidney transplants simultaneous and sequential, one after another. So we are not novices, we are known all over the world. There are certain protocols which we have developed, which are the bottom line is making it patient cost effective. Our protocol which we developed using certain drugs are being followed in 20 different countries all over the world. So we are a thinking team. We put ourselves in the patient's position. So here is a patient who comes with a TMA biopsy diagnosis and comes with no donor who is blood group compatible, so ABO incompatible, which was a no-no before. The biggest risk to ABO incompatible transplant is developing TMA. Again, the same TMA coming in and like a tsunami after transplant. And the secret of how to treat it is something which is not completely in our hands. But we were very, very careful right from the bird when the patient was moved into the operation theatre. Dr. Raghavendra was there, trying to shorten the surgery time, which our surgeons, Jairam Reddy, Harish and Hidayatullah were there. Incidentally, it was a laparoscopic nephrectomy which our expert, Dr. Harish, did. So we tried to minimize the transplant. There is what is called a second hit or a third hit. So we transplant to the second hit for TMA. Something background and then a second hit, it precipitates transplant. And lo and behold, he finished his transplant at 2 o'clock. We shifted him to the room with a very good urine output. 3 hours after the transplant, which is, I can tell you, 5 p.m., we got the first signal that something is not going right. And we did all the tests and we started the treatment immediately. Good blood pressure control throughout the surgery, short surgery, and immediate starting of medications. As Dr. Naveen said, eculizumab is not affordable. We did, ultimately I'll come to that figure, but we did start the treatment, especially in the nights. We had our problems starting at 5 p.m. But suppose even if it was at 2 p.m. in the night, we would have started the treatment immediately. That was our secret, one of the main important secrets of succeeding in getting him out of the TMA that happened within 3 hours of release of the clamp and transplantation. So 20 nights, I think our entire team, I should especially thank our fellows, 2 of them are there here, and there's Dr. Ram, and we were up through the night. We have 3-4 WhatsApp groups. So the dialysis unit is included in that transplantation group, and then we have our own internal group, and then we have a consultant group only, where we discuss certain things which only